everything I will go over is how to take care of your eyes tomorrow and on. You have received a green bag, and inside the green bag you'll find a blue folder. Inside this folder on the right side, you'll find a chart. This goes over what medicated drops you need to take after the LASIK procedure. The top chart goes over what to do tonight. That's just Vigamox 4 times. This bottom chart you start tomorrow, day 1 after the LASIK procedure, and on through day 10. For the first 5 days, you will be taking the Vigamox drop 4 times a day for those 5 days. For the first 10 days, you're going to be taking the Pred Forte drop, found in your green bag, 4 times a day as well for the next 10 days. For the next 5 days while you're taking both drops, we do want you to alternate between the 2 drops. Also make sure it's evenly spaced out throughout the day. So you can see we've assigned times to the drops on this chart. So let's say at 7 a.m. you take the Vigamox drop. At 9 a.m. you'll take Pred Forte, 11 a.m. Vigamox, 1 p.m. Pred Forte, and so on. Check off the boxes so you know where you are throughout the day. After day 5, we've clearly blacked out the Vigamox because you're only taking that for 5 days. You'll just continue Pred Forte until day 10, and then you're done. The only other drops you will be taking are lubricating drops. You can find this box of lubricating drops in your green bag as well. This is the Cystane Ultra Preservative-Free Lubricating Drops. Dr. Menger recommends that you take these lubricating drops twice an hour while awake for the first month after the LASIK procedure. For the second and third month after LASIK, Dr. Menger recommends at least once an hour. And month 4 and on, Dr. Menger recommends you use the lubricating drops at least 4 times a day. For the first 3 months, Dr. Menger definitely recommends this brand, and he really wants to make sure that you're using the preservative-free vials. So look for this little yellow badge in the corner. That indicates that it's preservative-free. Month 4 and on, if you'd prefer to use the bottle form of the lubricating drops, that's fine as well. But you can find these drops over the counter at any pharmacy, Target, Walmart, Amazon.com. It's fine too. We do want to make sure you're keeping your eyes covered for 5 days and 5 nights. We've given you those goggles to wear to sleep for the first 5 nights, making sure you tape them down on both sides every single night. And during the day, you can either wear the goggles, the clear lens glasses, or sunglasses while you're outside. Keep your eyes covered at all times for 5 days. Next, I'll go over how to be careful around your eyes and how to clean around your eyes. For tonight, definitely be extra careful. I wouldn't touch anywhere close to your eyes for tonight. Starting tomorrow, as long as there's bone, it's okay to touch, but for this soft tissue inside this 1-inch no touch zone, we don't want you putting any pressure for the first month after LASIK. You are going to want to clean around your eyes, so I'll go over how to do that. First thing, easiest way to clean around your eyes is, again, starting tomorrow, get in the shower, let the water hit the top of your forehead, close your eyes, and let the water run down your face for a couple minutes. The warm water does a good job of breaking up any buildup and washing it away. If after the shower you still feel like you need to clean something in the corners of your eyes or your eyelashes, get a Q-tip, wet it with some warm water, or for the ladies, oil-free makeup remover. Stand in front of a mirror, touch where there's bone, and pull down. Then you can trace along the lash line or do the corners of your eyes with the Q-tip without putting any pressure directly on your eyeball. As far as restrictions, there's no swimming for the first week after LASIK. Week 2 you can swim, but make sure you use waterproof goggles. Week 3 and on you can swim with no restrictions. No sweat in the eyes for 10 days. So if you plan on exercising, make sure you bring a towel with you, you wear a sweatband, you wear a hat, so no sweat gets in your eyes. No heavy lifting for 3 days. We mean about 100 pounds or more, just so you're not squeezing your eyes when you attempt to lift something heavy. Also, for the ladies, no eye makeup after 3 days. Face makeup is fine the next day, but as far as eye makeup, at least for the first month, avoid using waterproof mascara or eyeliner, but regular eye makeup is fine after 3 days. Last thing, you might notice some redness in the whites of your eyes. That is totally normal, purely cosmetic. It has no effect on your vision, and it will gradually go away over the next couple weeks. It might take a total of 2 to 4 weeks to completely go away.